MEDICARE City, where you'll learn about your Medicare options, is presented by DuPage Medical Group. As you travel the road to retirement, it's hard to see what lies ahead. When you reach 65, you have decisions to make about your health care, and you have 7 months to make them, including the 3 months prior to your 65th birthday, your birth month, and 3 months after your 65th birthday. You're eligible for Medicare at 65, but there are different Medicare parts and different ways to get those parts. If you retire later than 65 and are insured through your employer, your Medicare choices will be affected. So how do you navigate through a forest of paperwork to a Medicare plan that's good for you? Welcome to MEDICARE City. Here, you'll learn the basics you need to know to make an informed decision about the kinds of Medicare coverage you can choose. MEDICARE City has all the services you need to stay healthy: doctors and specialists, hospitals and nursing homes, pharmacies, and fitness centers. Which services are covered depends on Medicare options you choose. But which ones are right for you? What do they cover? How much do they cost? To find your answers, take the tour through MEDICARE City. Many of the services you need to stay well are covered under Original Medicare. You might need a hospital to get over an accident or illness, or perhaps a nursing home in case of a longer recovery. Part A in Original Medicare helps to cover inpatient services like hospitals and nursing home stays. Part B covers other services, such as doctor appointments or outpatient procedures. Parts A and B are Original Medicare. You pay a reasonable premium for Medicare. If you get Social Security, you can have it deducted from your Social Security check. But while Original Medicare covers a lot of services and the associated costs, it doesn't cover everything. In addition, you may still have a deductible to meet before Medicare begins to pay its share, plus copays and coinsurance. Copays, coinsurance, and deductibles are the dollars you pay from your own pocket for your healthcare services. For some people, Original Medicare, with its coverage for doctors, hospitals, and nursing homes, is enough. But what if you need expensive prescription drugs? Original Medicare is pretty good, but if you need expensive prescription drugs, then in addition to Original Medicare, you might need a prescription drug plan, or PDP for short. Prescription drug plans are called Medicare Part D and are sold by independent insurance companies. They may be offered as standalone drug plans or as part of a complete Medicare package. All Part D plans must offer benefits at least as good as standards set by Medicare. So, with Original Medicare plus a standalone PDP, you pay your Medicare premium plus a second monthly premium for your PDP. Other costs you may pay are your deductible, coinsurance, and copays. Together, Original Medicare plus a prescription drug plan will cover a lot of your healthcare expenses. If you have the flu or a cut or a sprained ankle, you may not have to pay much out of pocket. But what if you're faced with a major illness or surgery? Even though Medicare and your PDP cover a lot, the amount you still have to pay might be more than you can manage. The combination of Original Medicare plus a prescription drug plan will cover many healthcare expenses and the associated costs. But the copays, coinsurance, and deductibles could still be a lot, particularly if you suffer a major illness or surgery. This is where Medicare supplement insurance can help. Supplement plans cover some or most of the costs that Original Medicare doesn't pay. All supplement plans are standardized, but some have additional coverage. Like PDPs, Medicare supplement plans are sold by private insurance companies. With Original Medicare, plus a prescription drug plan, plus a supplement plan, you pay your Original Medicare premium, plus your PDP premium, plus a supplement plan premium, which means more in monthly premiums, but less in deductibles, coinsurance, and copays. For many people, Original Medicare plus a PDP plus a supplement plan is a good way to control costs. But paying 3 monthly premiums can be difficult for others. Is there any other way to get benefits in all parts of MEDICARE City without having 3 premiums to pay? Original Medicare covers many of the costs for doctors, hospitals, and nursing homes, Parts A and B, but not all. You can add a prescription drug plan, or PDP, to cover many of your prescription costs. You can also buy a Medicare supplement plan to cover most of your copays, coinsurance, and deductibles. With 3 plans, Original Medicare, PDP, and a supplement, you will have comprehensive coverage, but you also will have 3 premiums to pay each month. Is there any other way to get broad benefits in MEDICARE City without having 3 premiums to pay? Yes. You can choose a Medicare Advantage plan, or Medicare Part C. This can include coverage for doctors, specialists, hospitals, nursing homes, and prescription drugs, all in one plan. Plus, many Medicare Advantage plans have additional benefits: gym or fitness club memberships, smoking cessation programs, diet and exercise programs, vision or dental benefits, and others. You still pay a monthly plan premium for Medicare Part B. However, for many people, Part A does not require payment of a premium. Plus, a monthly premium for the Medicare Advantage plan. Some Medicare Advantage plan premiums are as low as $0. For a more comprehensive plan, a Medicare Advantage plan may be a great choice. But there are different kinds of Medicare Advantage plans. Which one is best for you? Medicare Advantage plans may provide coverage for many parts of healthcare. They are offered by private insurance companies and, by law, must have benefits at least as good as Original Medicare. Indeed, you still have Medicare. Many Medicare Advantage plans include extra benefits you don't get with Original Medicare. And usually, your out-of-pocket costs are lower than those with Original Medicare. There are 4 types of Medicare Advantage plans: Health Maintenance Organization, or HMO, Preferred Provider Organization, or PPO, Private Fee-for-Service, or PFFS, and in some areas, a Special Needs Plan, or SNP. With a Health Maintenance Organization, or HMO, you have a defined group of doctors, specialists, and hospitals that you can use. You also have a primary care physician who manages your health care, referring you to specialists or other services when needed. In an HMO, you will need a referral from your primary care physician to see a specialist. With an HMO, your out-of-pocket costs may be less than with Original Medicare. A Preferred Provider Organization, or PPO, also uses a defined network of doctors, hospitals, and other Medicare providers, but is more flexible. With a PPO, you do not need a referral to see any doctor or specialist. However, your out-of-pocket costs may increase if you use Medicare providers outside of the PPO network. The Private Fee-for-Service Plan, or PFFS, is the most flexible of the Medicare Advantage plans. You can use any Medicare doctor, specialist, hospital, or other provider who agrees to the plan's terms and conditions. Since you can use any doctor, hospital, or Medicare provider, your out-of-pocket costs may be more. In some areas, a Special Needs Plan, or SNP, is available for people with a chronic illness or eligible for both Medicare and Medicaid. These special needs plans have all the benefits of Original Medicare and include services for special healthcare needs. MEDICARE City can be a paperwork maze. What is the best way for you to get the services you need? Original Medicare provides you with coverage for doctors and hospitals in 2 parts of town, A and B. But there are still places you may need to go. Original Medicare plus a prescription drug plan helps you get the medications you need to stay healthy. Add a supplement plan to your Original Medicare and PDP, you get a lot covered, but you may pay 3 separate premiums. Medicare Advantage plans combine all parts of Medicare coverage into one plan. All of them must have coverage at least as good as Original Medicare. Many Medicare Advantage plans have benefits not covered under Original Medicare. So, how do you decide which plan is best for you? Consider 3 factors. Cost. Compare your costs now to what they'd be with each plan. include your premiums, co-pays, co-insurance, and deductibles. Providers. Will a plan allow you to choose your current doctors, or will you have to select new ones from a group? Benefits. Does a plan offer the coverage and benefits you need, plus the ones you want? Need more help? Here are some sources where you can get it. Hope you enjoyed the tour. It's our way of helping you find your way around Medicare City.